Hi, Mini Demo. My name is Brad Canham, and this is Eric Beal, PhD. Our company is Thermal Diagnostics, and the product line is called Fever Inspect. Um, Now, the reason that we're here and the problem that we're especially interested in focusing on is fever detection using thermal imaging cameras. The situation that we're in is, COVID-19 pandemic, and thermal imaging and fever detection is one of the technologies that is being talked about and used in um, detecting early symptomatic folks in public settings, professional office buildings, the state fair, any other mass gatherings. But there's also a problem in that marketplace. It's kind of a marketing science problem. Is there's a lot of marketing claiming to solve for detecting low-grade fevers in people that, based on our testing, is not up to snuff. Um, and therefore, the use of those thermal imaging cameras is more safety theater than it is actual safety. So we have focused on how to solve that using science. And Dr. Beal here is going to take us into how we built what we built, and then we're going to also describe some of the componentry, basically three aspects of the componentry and the hardware that work together to solve that issue.
Thank you, Brad. Now, as Brad alluded to, he said in a very polite way that there are other systems out there that are not up to snuff. Hundreds of companies have rushed into this field and they're selling systems that are little more than a box that displays numbers suspiciously close to 98.6, which is a special challenge to detect. You really can't tell without resorting to specialized equipment. If you use oral temperatures, you can't tell unless you have people with real fevers in your population. And so we happen to be kind of in the right place at the right time. We previously designed an image sensor. This typically it takes many months to design a new thermal sensor. We happen to have designed one 2 years ago that turned out to work very well for this. We redesigned every aspect of this from the ground up, and we found that our sensor was ideal for this. Now, we put this whole thing together and designed it in the last 4 months, and we validated it for surface temperature accuracy, that it can do what it needs to do to detect real mild fevers. So how can you detect a system that's just telling you numbers, what you want to see, as opposed to one that really is able to reduce your risk by identifying people with fevers of, say, 100.4? The way you can do it is you could use something like this, which is a forehead infrared scanner. These have low accuracy. They have enough accuracy for moderate to severe fevers, but the big challenge with these is that you have to get up close and personal, and they're extremely sensitive to how you operate them. And I'll demonstrate briefly with infrared calibrators. And these are used, you can use these to detect these, but they're very expensive. These particular units are over $8,000 a piece. And they are challenging to operate and set up. So I'm going to test this on a 90-degree black body, 97.3. And I'm going to test this on a 99-degree black body, 101.5. Now, what's going on here is that all of these non-contact systems, the science behind this is that these measure the surface temperature. This also has a surface temperature mode. And let's measure the surface temperature, 90.2 and 99.0. So what is going on? What it's doing is it should be taking the surface temperature, saying if it's 72 degrees in here, we need to add 4 degrees to that. This is a calibrated measure that's been determined in clinical trials that depends on the ambient temperature. So you really need to sense the ambient temperature. And guess what? This one does not have an ambient temperature sensor anywhere inside. I looked. So if this one was 90 and this one was 99, this one in body temperature mode ought to have read 94 and indicated this person is extremely cold. But instead, they added somewhere around 7 degrees to it. And now when it's measuring 199, it only added 2.5 degrees to it, which is suspiciously close to 98.6. And we've seen many systems doing this.
So they're like pushing the numbers, squeezing the numbers together.
That's right. They're just telling you what you want to, what you expect to see. So here's our system. It's in surface temperature mode, where we always have to start. 89.8 for the 89.6 degree black body. We switched over to the 98.5-ish, oscillating around. Now currently it's in surface temperature mode, as indicated by the blue light. Turn this off, and see if it detects a fever. 103.3 on the right black body. And that's more like what I'd expect for a black body that warm.
So, and it does this because we've got some additional sensors in there as well as
Yes, that's
the
right, Brad.
infrared camera.
So these single pixel sensors, they can be calibrated to be accurate, but you can't get an image of it. With image sensors, the best accuracy you can get is about 3.5 degrees Fahrenheit, which is essentially useless. The only way to get an off-the-shelf system to get accuracy you need is to include one of these things next to the subject's head or somewhere in the field of view. In our case, our technical innovation is that we've integrated miniaturized versions of these black bodies into the system itself. We also use a distance rangefinder so we can tell exactly how far away the face is and not have a inaccurate reading. 99.1, we're both a little warm today, but still well within limits. And so that's how you can take the science of surface temperature measurement and turn it into a core body temperature, which is what you need to reduce your risk in this day and age.
All right, great. So our ask is we are manufacturing these units right here in the U.S. and actually Wisconsin and Minnesota. Our call to action is we're looking for folks who want to talk about safe thermal imaging as a part of their protection that they're going to bring to professional buildings, food production, integrators, access controls, those kind of folks. You can reach us at safety@feverinspect.com. That's safety@feverinspect.com. Thank you so much.
Thank you.